Hello everyone, welcome to NG's Corner for Nurses. Hope all of you are doing well. Today our topic of discussion is abdominal hernia. Let's start today's session. In this video, we will cover the abdominal hernia along with its definition, types, risk factors, pathophysiology, clinical manifestations, diagnostic studies, and the management and prevention. So what is hernia? The word hernia means protrusion or bulge or projection. So hernia is a protrusion of a viscous through an abnormal opening or a weakened area in the wall of the cavity in which it is normally created. And what is abdominal hernias? Abdominal hernias are also known as external hernias. When abdominal organ or part of an abdominal organ protrudes through the abdominal wall, usually at a site of weakness, it is known as abdominal hernia. Next, coming to the types of abdominal hernia. First is midline hernia. Whenever the herniation is present in the midline of the abdomen, it is called midline hernia. The examples of midline hernia are epigastric hernia and umbilical hernia. Next, whenever the herniation present at the groin site, it is known as groin hernia. The examples of groin hernias are inguinal hernia and femoral hernia. Inguinal hernia can be subdivided into two types, direct inguinal hernia and indirect inguinal hernia. Another one is incisional hernia or ventral hernia. Whenever herniation appears in the abdomen in the previous surgical site or incisional site, it is known as incisional hernia or ventral hernia. Let's discuss each types of hernias in details. Next, coming to the first type, that is epigastric hernia. We are familiar with the term epigastric. If we divide our abdomen into the 9 quadrants, the upper middle quadrant is known as epigastric region. Whenever a herniation or bulging appears in this epigastric region or in the area below the rib cage and above the belly button, it is known as epigastric hernia. It can develop in both women and men. It generally develops in people who are born with a weak spot in their abdominal muscles. In case of this type of weakness, any forceful activity such as sneezing, coughing or lifting heavy objects can cause the bulging. Next is umbilical hernias. It occurs near the belly button or navel or umbilicus. An umbilicus is a natural weakness from the blood vessels of the umbilical cord, and this area of weakness can persist throughout life, and this type of hernia can appear in men, women and children at any age of their lifetime. It can be caused by abdominal pressure due to being overweight, excessive coughing or at the time of pregnancy. Next, coming to inguinal hernia. It is an example of groin hernia. Inguinal hernias are the most common type of hernia and they represent approximately 2/3 of adult hernias and are much more common in men than in women. They occur in a part of abdominal wall which is known as the inguinal canal, where a man's testicle must descend before birth. And this leaves a natural defect called the internal inguinal ring that can develop into a hernia if it doesn't seal properly. As a result, the content of abdomen such as intestine may protrude through this opening, creating pain and bulge. Inguinal hernias are located in the lower abdomen just above the leg crease, near or adjacent to the pubic area. And sometimes it occurs on both sides of the pubic area. And this condition is known as bilateral inguinal hernias. Inguinal hernia can be further divided into two types, indirect and direct inguinal hernia. First is indirect inguinal hernia. Indirect inguinal hernia is more common in men than women because before birth the men have a natural opening where a spermatic cord and the testicle pass out of the abdomen into the scrotum. The path that the testicles travels into the scrotum is called the inguinal canal. Sometimes the opening at the top of the inguinal canal does not close properly after the testicles have passed through. The opening weakens the abdominal wall, increasing the risk that a hernia may develop. And this is called a congenital weakness because it is present at the time of birth. Women also have an inguinal canal, but they are far less likely to develop a weak spot in this area because they do not have a spermatic cord passing out of the abdomen. Next is direct inguinal hernia. This type of hernia may develop when the body's continuous cycle of breaking down and building up tissue is no longer in balance, causing weak spot to develop in the muscles and tissue. Increased pressure or straining can also weaken the muscles or connective tissue of the abdomen, and it allows the part of intestine to slip through that weak spot in the abdominal wall. Increased pressure can be caused by weight gain, sports injuries or activities such as heavy lifting, chronic coughing, vomiting or straining on the toilet due to constipation. A direct inguinal hernia is a result of weakness in the floor of the inguinal canal and is more likely to develop in older men over the age of 40. The floor of inguinal canal is located just below the internal inguinal ring. Next, coming to the femoral hernia. These type of hernias are much more common in women, but it can also occur in men. And these hernias appear just below the groin crease and are usually the result of pregnancy and childbirth. That's why it is more common in women. A weakness in the lower groin allows an intestinal sac to drop into the femoral canal, a space near the femoral vein that carries blood from the leg. And these hernias are more prone than inguinal hernias to develop strangulation as an early complication. We know strangulation means obstruction of blood flow. And as because the location of these type of hernia is just near to the femoral vein, strangulation is very common in case of femoral hernias. Next is ventral hernia or incisional hernia. A hernia that appears in the abdomen at the site of a previous surgery is known as a ventral or incisional hernia. These hernias can appear weeks, months or even years after surgery and can vary in size from small to very large and complex. An incisional hernia is caused by weakening in the scar tissue that develops after a surgery on abdomen. If anyone gain a lot of weight after an operation, he is at higher risk of developing an incisional hernia. And before healing of the surgical site, the forceful activities like coughing, sneezing or lifting heavy weights may also lead to this type of hernia. Apart from previously mentioned types, there are another two types of hernias, reducible hernia and irreducible hernia. Hernias that easily return to the abdominal cavity is called reducible hernia. The hernia can be reduced manually or may reduced spontaneously when the person lies down. It is uncomplicated hernia. And if the hernia cannot be placed back into the abdominal cavity, it is known as irreducible or incarcerated hernia. The word incarceration means the state of being confined. These are most complicated hernias. Since the contents are locked out of the abdomen, this builds in decreased venous and lymphatic flow, and as a consequence, edema and swelling of the incarcerated tissue. Eventually, the tissue can swell so much that the arterial blood flow to the hernial sac contents is cut off, and this condition is known as strangulation, and it leads to ischemia and tissue necrosis. Let's see what are the causes of abdominal hernia. Abdominal hernias are caused by a combination of two factors. One is weakness in the abdominal wall and another one is increased abdominal pressure. Let's see the risk factors that contribute to hernia development. First is congenital defect. Some people are born with weaknesses in their abdominal wall, which can predispose them to develop hernias. Next is premature birth. In case of premature birth, the baby may be born with weaknesses in abdominal muscles, and that can lead to hernia development. Next is aging. As people age, their muscles can weaken and making them more prone to develop hernia. Next is family history. A family history of hernias can also increase the risk of developing hernias. Next is sudden weight gain or obesity. Excess weight can put pressure on the abdominal muscles, increasing the risk of hernias. Next is heavy weight lifting. Straining while lifting heavy objects can put stress on abdominal muscles and increase the risk of hernia. Next is chronic coughing and sneezing. Persistent coughing, especially from conditions like COPD, can increase intra-abdominal pressure and weaken the abdominal wall. Next is constipation and straining. Straining during bowel movements can also increase abdominal pressure and that leads to hernia. Next is pregnancy. The growing uterus can put pressure on the abdominal wall, making it more susceptible to hernia formation. Next is previous abdominal surgery. Surgeries can leave weak spots in the abdominal wall, increasing the risk of incisional hernias. Next is abdominal injury. Abdominal injury can leave a weak spot in the abdominal wall and that leads to hernia development. Next is ascites. Ascites is a condition where there is a fluid accumulation in the abdominal cavity, and this condition can increase the abdominal pressure and that leads to hernia formation. Let's discuss the pathophysiology of hernia. In previous slide, we have already discussed the risk factors of developing hernia. That risk factors leads to increased intra-abdominal pressure. And when the intra-abdominal pressure increases, the internal body parts pushes through a weak area of muscle or the surrounding tissue wall. And this pushing force leads to the formation of an opening. An abdominal organ or a part of abdominal organ pushes through that opening and that creates a bulge or herniation. Next, coming to the clinical manifestations of abdominal hernia. Clinical manifestations of abdominal hernias primarily include a visible or palpable bulge in the abdomen or groin area, often exacerbated by straining or cuffing. Bulge or lump is a very common symptom visible or palpable bulge in the abdomen, groin or scrotum, particularly noticeable when standing, straining or coughing. Next is mild to moderate pain or a feeling of pressure or fullness in the affected area, often worsening with physical activity. A bulge may be tender to the touch, especially if the hernia is inflamed or incarcerated. And there may be some bowel related issues. In some cases, hernias can lead to constipation, bloating, or even intestinal obstructions, particularly if a portion of the bowel is trapped. And in that case, we also can see the symptoms like nausea, vomiting. And in case of incarcerated or strangulated hernias, these can cause severe pain, nausea, vomiting and fever and require immediate medical attention. And in case of inguinal hernias in males, may cause swelling or pain in the scrotum if the hernia extends into it. What all are the diagnostic studies to be done for abdominal hernia? At first, we have to collect history and we have to do physical examination. At first, we will collect history regarding any congenital problems, previous history of hernia, weight gain, pain in the lump area, nausea, vomiting, constipation, abdominal surgery and heavy lifting. And also, we will take a history regarding all of the risk factors, and then we will do abdominal examination. We will inspect and palpate the lump. Next, the X-ray, ultrasound and or CT scan or MRI can be done to locate the size and position of the hernia. Next, coming to the management of abdominal hernia. There are no such medical management to treat hernia. To reduce pain, we can administer non-steroidal anti-inflammatory drugs, or to reduce vomiting, we can administer antiemetics, and after surgery, antibiotics and anti-inflammatory therapy is given to reduce the risk of infection and inflammation. The one and only treatment of hernia is surgical management. Let's see the surgical managements of abdominal hernia. First is herniorrhaphy, repairing the defects by stitching the healthy ends of the tissue or muscle. Single long incision made, the bulge is pushed back into place and the weak spot in the muscle wall where the hernia bulges through traditionally has been repaired by sewing the edges of healthy muscle tissue together. Next is hernioplasty, repairing the defect using mesh patches. Mesh patches of synthetic material are used to repair hernias. Patches are sewn over the weakened area in the abdominal wall after the hernia pushed back into the place, and the patch decreases the tension on the weakened belly wall. Nowadays, laparoscopic treatment is also done, and strangulated hernias treated immediately with resection of the involved area or a temporary colostomy so that necrosis and gangrene do not occur. Next, coming to the nursing management. The nurse should check the skin irritation caused by a continual rubbing of the truss against the skin. What is truss? Some patients with hernia wear a truss, a pad placed over the hernia and held in place with a belt. It is worn to keep the hernia from protruding. Observe for distended bladder because after repair, patient may have difficult voiding. Scrotal edema is painful complication of inguinal hernia repair. So scrotal support with application of an ice bag may help relieve pain and edema. Coughing should not be encouraged, but deep breathing and turning should be done. And incision should be splinted during coughing or sneezing. It should be splinted by abdominal binder or with pillow to reduce pressure on the surgical site. These are some possible nursing diagnoses related to hernia. Please go through it and prepare a nursing care plan of your own. Let's see the complications of hernia. First is enlargement. Hernias can grow larger over time and putting pressure on surrounding tissues and causing pain. In men, a large inguinal hernia can extend into the scrotum, leading to pain and swelling. Next is incarceration. An incarcerated hernia is one that cannot be reduced, that is irreducible hernia. And this can lead to pain, nausea, vomiting, and the inability to have a bowel movement. If the bowel tissue is trapped, it can obstruct the bowel, preventing food and gas from passing. Next is strangulation. A strangulated hernia has its blood supply cut off. This leads to tissue death, which is a life-threatening emergency and require immediate surgery. Next is bowel obstruction. If part of the small intestine is trapped within the hernia, it can cause a blockage, preventing the passage of stool. And this can cause severe abdominal pain, nausea, and vomiting. Next is chronic pain. Hernias can cause persistent pain in the area of the hernia. Next is infection. The area around the hernia can become infected, especially if the blood supply is compromised. Next is testicular strangulation. In men, a large hernia can compress the testicle, cutting off its blood supply. And the last one is recurrence. After surgery, a hernia can sometimes return. So how we can prevent hernia? By maintaining our body weight, by consuming high fiber foods, grains, seasonal fruits and vegetables, by drinking plenty of water, at least 3 liters per day, avoid heavy lifting, by stop smoking because it causes coughing, by control allergies to avoid sneezing, and by doing exercise to strengthen abdominal muscles. If this content is useful for you, then please put a like and share it with others. And for getting more videos like this, you can subscribe my YouTube channel NG's Corner for Nurses. And for any queries or suggestions, you are most welcome to comment. Thank you for listening.